Hi guys, this is Charles. I'm one of the surgeons at Southpaws. Today we're doing an interesting case, an unusual one, which is a dermoid sinus in a Rhodesian Ridgeback. So this is a 4-month-old puppy that presented with this draining sinus from the dorsal midline of the cervical region. And we've done a CT scan and confirmed that a dermoid sinus is present. Now I'm just inserting a 3 French urinary catheter in here as far as it goes. And we'll get some idea of what kind of depth we have to find, or what we can expect to find. And so we'll just dissect it down as far as it goes. If you haven't already done so, please subscribe to our channel and make sure you turn on notifications. So anyway, we'll go ahead and get started. So by putting in that catheter in there, I can palpate the sinus a little bit better. You can see as I squeeze it between my fingers, the catheter jumps across from one side to the other. So we're just going to elevate the skin here, and I'll go ahead and make my incision. So dermoid sinuses are categorized by how deep they go and how superficial they go. So does it communicate with the skin? Number one, and number two, how far, can I get cautery plugged in, please? How far deep does it go? Does it go to the nuchal ligament? Does it go beyond the nuchal ligament? Does it go all the way down to the spinal cord? Based on the CT scan and the lack of neurologic deficits, I don't think this one goes all the way down to the spinal cord. I think it's going to go kind of halfway between the nuchal ligament and the dorsal aspect of the vertebral body. So just starting our initial incision here. And then I'll make an equal incision on the other side. And interestingly, the microchip is immediately adjacent to the sinus. We can see it right here. And so I'm going to have to try to reimplant that or avoid taking it out altogether. We do have the live chat running as well. If you have any questions, you can ask them. If I'm not concentrating too hard, I'll try to answer them straight away. Otherwise, I'll get back to them before I'm finished.
A question about whether you resolved the YouTube issues with the virtual tour?
There was a question. I have tried to go back in and turn on comments on the virtual tour, and I have not been able to do that. So I think it's a setting that I messed up when I did the initial stream, and I have not been able to go back in there and change it. Just I'll get these little guys in onto that. The other one, and then I'll just put one end to end to try to stretch this out a little bit better. Alrighty. Can we please get some more towel clamps? Try to avoid that microchip. I'm not sure how well a microchip will go, having been cauterized. So I'll be able to push it out of the way for now. And as I'm dissecting, so we can feel this tube heading down right here. I'm not sure if you guys can see this. Tube's going off to the side a little bit. So we can see that still extending all the way down to there, at least. So that's quite long anyway. And if you don't excise the entire sinus, they can recur.
And also drop the teeth. Yeah. Would have been nice with that. Actually, see what dropping the teeth does first.
Okay, so just hold on to that for me, please. I'm going to be a little careful with my electric cautery that I don't transect the sinus and lose it, because that would be annoying. Come back over here to this side. I am treating this almost like a cancer in that I'm trying to get a margin on it so that I'm less likely to cut it off and leave some in there.
Might take about 5 or so minutes before you see a difference.
Okay. And this is a surgery that can be attempted in general practice. The problem is that if you start it and then you find out that it's going all the way down to the spinal cord, you could get into trouble, and it would be difficult to just close it up and have somebody else come in, because then all anatomy would be screwed up. And so general tendency would be that this would probably be a surgery that you'd want done by somebody who has advanced imaging and also some experience with dealing with these. If you don't have that option available, then obviously you do what you can. And you can transect the nuchal ligament in dogs without having any dysfunction, as in they won't drop their heads, at least not permanently. They will be a little bit weak initially after surgery, but long term they can cope pretty well. So.
Question about if this sinus is attached to the spine?
So if the sinus is attached to the spine, then we'll have to do a laminectomy, dorsal laminectomy, which is pretty challenging. It's unusual anatomy for us. It'd be like doing a deep dorsal laminectomy in a wobbler. And then you'd have to be careful for the spinal cord, which is going to be right underneath it. And sometimes they can even attach to the dura.
Question about the joint over the laser, if we use contrast MRI to track the sinus?
MRI would be great. And you can even inject contrast down the sinus itself, although I haven't had a lot of luck with that in the past. I find fistulograms or sinus contrast studies to be generally fairly unrewarding. You just get contrast everywhere and it makes a big mess. can still see it right here.
Mhm.
All right, so I think that that's the bottom of the sinus right there. So that is, let's get a measurement on that with it stretched out. That is about 7 centimeters, something like that. So I don't know if you guys can see that all the way down at the nuchal ligament, where it's coming to an end, right about there. So I'm still going to go even a little bit further. All right, so that's the whole thing out there. So let's have another look at that. See how far down it came. It came all the way down to there. So look how long that is. So that's quite a long sinus. It's interesting that the catheter did not travel all the way down. So hold on to that, and I'm going to transect it. And then see if we can see what that looks like. So there's hair down there still.
There's a lot of hair on it.
Yeah, so where's our catheter? Let me just see if I can. I can't catheterize it. Did some exudate come out?
Yeah.
So anyway, I'm trying to catheterize the distal segment. I can kind of get it in there. Anyway, so that's pretty interesting.
Yes,
Anyway, so that's kind of cool. Can we get, so the nuchal ligament is just right there. You can see the white sitting right there in the middle. You can separate the two sides of the nuchal ligament. So that's nuchal ligament sitting right there. Can we get some mepivacaine, please? So just some mepivacaine when you get a chance. Thank you. All right, so there aren't any other questions that I can see. Anyway, so that's it for that part of the surgery. We'll go ahead and close. We're going to inject some mepivacaine into the muscles, and then we'll just close that muscle fascia on top. And I think there might be another one back here that's just a very superficial, they call it, I think it's a type 6, which doesn't communicate either with the skin or with the spinal cord. So it's just kind of floating in the middle. And it's questionable as to whether you need to remove those or not. I'm having trouble finding it now. Just feeling up in there.
There's a question about what is the nuchal ligament?
So the nuchal ligament is a structure that connects from the back of the head all the way up to the thoracic spine. And it acts like, if you think about a suspension bridge, where you have the posts in the suspension bridge like this, and then you have a cable going across between the two, and then wires that are coming down, and that's what keeps the suspension bridge straight. And so it works the same way with the nuchal ligament and the head, and so that's what allows the head to remain elevated despite the fact that it's cantilevered out quite far away from the rest of the body. And that's spelled Nucchal, nuchal ligament. Is it double C or single C?
I mean, I want to go single, but my spelling isn't the best.
All right, it might be single C. So we're just going to inject some bupivacaine into the muscle to provide a little bit of pain relief. And I'll get some 2O PDS, please. And all we really need to close is this fascial layer and then sub-Q and skin. I'll just put some interrupted sutures in the muscle down here as well. Question about mepivacaine. I can't really read it.
It
Jeff?
says, what advantage does the drug mepivacaine have over bupivacaine?
So mepivacaine is a lot cheaper and easier to get, and it lasts, I think, a little bit longer than bupivacaine.
A little less.
A little less than
But it has
bupivacaine.
a somewhat quicker onset than bupivacaine.
And quicker onset is what Jeff is telling me. Is that the layer that, I think that's the layer that I'm closing this asymmetrically.
Yes, there it is.
Let's see what we got here. I think this is what I've been closing to here, yeah. Let's release those sutures there. So where is that fascial layer on this side? So I've got that thick layer right there.
I believe it's
There? You reckon? Just trying to find the paired muscles on both sides.
I think there's 3 distinct layers that I can see.
Yeah. Okay. Just run that as a simple continuous then. That for me, please. And I don't think I'm going to go after that other sinus. It's not causing any problems. Anyway, so that's pretty much it for this. We're just going to do a routine closure now. And so I'll come over and have a look at the live stream questions and make sure that I've answered everything. And I'll let Jeff continue closing this. Just have one more palpate to see if I can feel the other. Generally, if they're not causing neurodeficits and they're not communicating with the skin, you don't need to remove them. Yeah, I can't feel anything, so we'll just leave that. All right, so I'll leave this to Jeff to finish up the closure. And if you have any questions after the live stream, please feel free to post them. And that's pretty much it. So so if a dog has one of these, is it guaranteed it will need to be removed at some point? Okay, I already answered that. And so these are meant to drain out dead cells and tissues, but not all dogs have it. So sometimes they can be blind at both ends, and those don't need to be removed. And that is pretty much it. So thank you very much for watching. Make sure you subscribe to our channel and turn on notifications. And that's it for my live stream. Thank you very much.